So a neck lift operation or procedure is surgical operations carried out in order to improve the contour of the neck. As we age, we tend to develop sagging skin and muscle of the neck, and this is often in combination with the aging that occurs in the upper part of the face. Most patients that seek a neck lift are concerned about the fact that the contour of the neck is not as smooth as when they were younger, and they're often troubled by excess skin and sagging muscles. So the idea of the procedure is to try to remove the extra skin, to try to tighten the muscle, and to try to improve the contour of the neck for the patients. Most of the patients that come to see me for neck lift operations have both aesthetic and functional issues. In terms of aesthetic problems, patients are often unhappy about the look. They find that because the skin is sagging, and they find that actually they don't look as young as they did before. They also can develop functional problems because the sagging skin can, for example, interfere with gentlemen wearing shirts and ties. It can interfere with ladies wanting to do sporting activities. So there are aesthetic as well as functional issues why patients end up having a neck lift. Counterintuitively, neck and facelift surgery are not actually painful. Before we do the procedure, I infiltrate the area with a long-acting local anesthetic. This tends to last about 12 to 14 hours following surgery. And then once that wears off, most patients are able to manage their pain with simple paracetamol and codeine. And so pain is really not a major feature of this operation. This is a really, really good question. And the answer to this is that it is very variable. What we find with neck lift surgery is that in terms of longevity, it tends to be a little bit less than other forms of facial plastic surgery. The longevity of the procedure really depends on the patient's skin quality and the procedure that's done in order to tighten the skin and muscle. On average, we would expect a neck lift to last somewhere between 5 to 10 years before patients require any other form of intervention. Neck lift surgery actually is fairly complication-free. The issues that we worry about are the major complication or risk of bleeding following this form of surgery. That's why I keep my patients in overnight in order for them to have their blood pressure controlled, and the nurses tend to look after them to make sure that they don't need to get out of bed and do anything. And generally after that 24-hour period, once they get discharged, the risk of bleeding is then significantly reduced. There are dangers in terms of getting some numbness around the ear, which is where the nerve comes in to supply the ear. So, and that can sometimes be temporary and very, very occasionally permanent. And you can also develop some contour irregularities or essentially a little lumps and bumps from the liposuction component of the neck lift. But again, with time and massage, they generally tend to settle down. Again, as I said, really neck lift surgery doesn't have huge complications, and we usually, after a week when the patients have had the surgery and these things have settled down, there's often then no long-term issues.